Good afternoon. My name is Jen Selkin, and I'm with the Benjamin Rose Institute on Aging. And thank you for joining us today for Benefits You Gave, You Save. This program is part of our series of virtual programs for caregivers that we provide each month. This program will be recorded, and we'll be sharing the link with you all in an email the next couple of days. It will also be shared on our website on the event registration page and in our resource library. Please feel free to share this with friends and family who could not join us today. We have a lot of information to cover this afternoon, so we'll be holding all questions until the end of the presentation. However, you may submit a question at any time using the control panel on the right-hand side of your screen. There are also 5 handouts that our speaker has provided today as a resource for you. You can download the handouts in the control panel on the right side as well. In addition, they will be emailed. Before I introduce our speaker, I'd like to tell you a little bit about Benjamin Rose. We are a Cleveland-based nonprofit founded in 1908. Our mission is to support caregivers and empower all people to age well through research, consumer responsive services, and client advocacy. We provide a variety of services and supports to help people age well in the community. That includes behavioral health services, social work, counseling, and coaching to help people achieve financial wellness and housing stability. And we also operate the Rose Centers for Aging Well, our senior centers, which are located throughout the Cleveland area. And we are a Meals on Wheels provider. It is now my pleasure to introduce today's speaker, Cynthia Walker. Cynthia is the Medicare and Benefit Enrollment Counselor with ESOP, a subsidiary of Benjamin Rose, and she'll be telling you a bit more about some of the services they offer. Please join me in welcoming Cynthia.
Good morning, everyone. How are you? Well, afternoon, everyone. I hope everyone is doing good today. My name is Cynthia Walker, and I am here to present to you one of our virtual financial education workshop, part of our series from ESOP. Next slide. So today's workshop is You Gave, You Save. How can you benefit from social benefits that are available to us? Next slide. So ESOP, who we are. ESOP stands for Empowering and Strengthening Ohio People. And we are a nonprofit HUD-approved housing and financial counseling agency. What we do is we help adults in all stages of life to achieve and maintain financial wellness and housing stability. Our vision here at ESOP has always been community in which everyone has economic opportunity and financial stability. Next slide, please, Jen. Okay, so some of the services that we offer here at ESOP. We have our financial programs and our housing programs. I'm not going to go through all these programs for the sake of time, but one of the programs that I do want to point out to you all is the Prevent Blindness program that we have for eyeglasses. It's the vision screening program. This program we do with Prevent Blindness Ohio, and it allows seniors who does not have vision coverage the opportunity to get a free eye exam and a free voucher through the program. It's an excellent program, and I hope you share this information. All they have to do is get in contact, and I'll provide my contact at the end of this presentation for you. So next slide, Jen. What is Medicare? So Medicare is a federal and state funded health insurance program for low-income individuals and family. Medicare can provide you with medical care and other services if you have limited income and resources. Each state sets its own program guidelines and decides what type of services will be provided. There are many different types of Medicare programs. Next slide, Jen. Give me one moment here. My screen is acting up a little. So Medicare, the different type of Medicare options that we have. We have the modified adjusted gross income, also called the MAGA. It is for parents, caretakers, relatives, pregnant women, and children, individuals aged 19 to 64. Then we have the categorically needy or aged, blind, and disabled. Now, this is for individuals age 65 and older, which will be the bulk of what we're talking about here in Medicare. Disabled individuals and blind individuals. And then we have the Medicare Premium Assistance Program. This is for Medicare recipients. Can we go to the next slide, please? So this is a graph of the Ohio Medicare 2021 monthly financial eligibility numbers for the age, blind, or disabled individuals. So it goes by, for the Medicare premium, if you can see the title up there, they have the different Medicare premium programs, which we'll talk about later. They are the qualified Medicare beneficiary, QMB. Then we have the specified low income Medicare beneficiary, Slim B, and the qualified individual, QI. Then we have Medicare for the age, blind, or disabled individuals, and then the Medicare buy-in for workers with disability. So these are the income levels that these individuals have to meet in order to qualify for these programs. For instance, for the standard Medicare for age, blind, or disabled, for a single individual, your income has to be at or below $794, which actually happens to be the amount that individuals receive for SSI. And for a couple, $1,191. To qualify as a single individual for the QMB, your income has to be at or below $1,074. For the Slim B, for a single individual, $1,288, and so on. It goes by the size of the family and the income level. Okay, can we go to the next slide, please? So other programs that Medicare offer, these are long-term programs and home-based program. It's the Institutional Long Care Program. This program provides nursing home or similar institutional care for individuals who are no longer able to perform basic day-to-day activities on their own. This program is relevant to the elderly and the need for and care due to the natural process of aging, sickness, or the progression of Alzheimer's, Parkinson's disease, or another type of dementia. For the most part, long-term care is for non-medical use, such as bathing, getting dressed, those type of things. This program is for. Can we go to the next slide, Jen? Next slide, Jen.
It is on the next slide.
Oh, I'm sorry. They look the same. Home and community-based services. One of the things that we're finding is older adults, they want to age at home, and they want to age at home gracefully. So we have the home community-based service program through Medicaid. This is a special Medicaid waiver program that provides long-term support and services in individual's home or their community. The type and number of services available depends on that individual needs and what the state will cover. Services again may include personal care, housekeeping, chore services, adult daycare, respite care, transportation, medical supplies, equipment, home delivered meals, grocery shopping, housing modifications, so that an individual can gracefully age at home. Next slide, please. So for the long-term care eligibility for seniors, we have the institutional home and Medicaid, and then we have the Medicare waiver, home and community base. And then again, we have regular Medicaid. Now you will see here in this graph that the income limits are different for the institutional nursing home and for the home and community base. They're higher. An individual's monthly income can be as high as $2,382. However, it is the asset limit for those individuals for all the Medicare programs, $2,000, and that's usually where the hiccup come at with these programs. But all is not lost. For a married couple, if they are both applying, the income limit for the two programs is $4,764, and the asset limit raises to $3,000. Okay. But if only one spouse is applying, and this is usually what we find a lot, that is only one spouse that may be applying for the assistance, things change. Now, for the individual, the monthly income stays the same, and the asset limit stays the same for that individual that is applying. But what they do with the assets and the resource that the individual have is that they split those assets between the husband and wife. And whoever is applying, they can spend down their asset to meet this 2000 goal. Now it has to be documented. Everything has to be documented, and you can only spend it on medical needs. For individuals in a situation like this, it's often recommended that you seek the advice of a Medicaid planner, because in these programs, the nursing home, and institutional nursing home, and the waiver program, they do a 5-year look back to see if any assets has been transferred out of the name. Okay, can we go to the next slide? So let's talk a little bit more about the Medicare Savings Program through Medicare. This program is done through Medicaid, but what it does is it pays for your Medicare Part B premiums, that $148.50 that's being deducted from your Social Security income. It helps individuals with limited income and assets to pay for some of their Medicare costs related to their health. It pays their late enrollment penalty if an individual um, may be penalized because they didn't enroll in, let's say, Medicare Part B or Medicare Part D during their initial enrollment period, because these are something that you have to let Medicare know that you want to participate in. They're not automatic like Part A. You have to verbally or in writing or whatnot let Medicare know that you want to participate in Part B and Part D. And if you do not choose to do so at the time of the initial enrollment, and let's say 5 years down the road, you find that you need those services, you can get them, but there'll be a penalty applied to your premium, and you'll carry that penalty throughout the life that you're receiving those services. So the Medicare savings plans, one in specific, will take care of those penalties for you if you owe any. So with these programs, the state Medicare program works with the Medicaid to provide you with this assistance. And there are 4 types, but I think we're only going to talk about 3. Let's go to the next slide, Jen. So we have the QMB, which is the qualified Medicare beneficiary. We have the specified low income Medicare beneficiary, which is called the Slim B, and then we have the QI. Now the QMB, go ahead and click for me, Jen. It acts like a free supplemental policy to your Medicare. QMB pays for your Part B premium. It pays all your deductibles, your co-insurance that Medicare does not pay. Go ahead and click, Jen, for the Slim B. Slim B pays for Medicare Part B premium only, and they will retroactively, once you have been approved for the program, pay you back 3 months of the premiums that you have previously paid. Go ahead and click, Jen. And then the QI only pays for the Part B premium. However, with the QI, you do have to apply each year because they only have so many slots available. Next slide. So let's talk about some prescription assistance that you could get. Go ahead and click, Jen. So we have the Low-Income Subsidy, also called extra help. I didn't realize this print was so small. So if you are able to access Medicare Part D drug coverage and you have limited income and savings, you may be able to receive this extra help for your Medicare Part D low income subsidy. This program can help you pay for your Part D premiums, deductibles, and prescription copays. And the extra help does have two levels. It has full extra help and it has partial extra help. The full extra help will pay for your complete deductible. The partial extra help will bring that deductible cost down. Now, this year, the deductible cost can go as high as $480. And this is what you have to pay out of pocket before your plan starts paying towards your prescription drug costs. That's a lot of money for individuals with limited income. So when you get partial extra help, it brings that deductible down substantially. This year, it brought the deductible payment down to $89. So that's a far cry from that deductible that most people had to pay of $455 this year to only have to pay $89 before the plan kicks in. Next slide. So for the low income subsidy extra help, for a single individual, your monthly income needs to be at $1,630 or less. And for a married couple, $2,198. Your total resources that are allowable with this program for a single individual is $14,790, and for a married individual, $29,520. So that's a substantially more than what is allowed with Medicare. What's also great about the low income subsidy is that when you apply for this and you are approved, it generates what is called a special enrollment period, which will allow you to go in and look at your Medicare Part D plan and see if there's a better option out there for you. And also, when you're approved for this plan, you have 3 opportunities within a 9-month period in which you can go in, if you so choose, to change your plan. The periods are between January and March, April and June, July and September. Now, annual enrollment starts October 15th. So this is a plug for open enrollment for Medicare Part D, which is going to start on the 15th, which will allow everybody to go in, whether you have a standalone Medicare Part D plan or Medicare Advantage plan, to go in and look at the plan and make any changes or adjustments for the upcoming year. These changes for the open enrollment period will take effect January 1st. However, in the other opportunities that you are allowed to go in and elect to change your plan, those plans will take effect on the 1st of the following month. Can we go to the next slide, Jen? So there's a program called Limited Income for Newly Eligible Transition Program. This is a program that this assists you once you qualify for the extra help. And I have to tell my clients all the time, Social Security and Medicare are 2 big entities that have to work together, and they are slow moving machines. So it takes some time for everything to get connected, but it'll work itself out. What this program does, when you are approved for the extra help, you'll receive a notice from Social Security stating your approval, and you could take that to your pharmacy and they'll sign you up for this limited income newly eligible transition plan, so you could get your medication at a discounted price. Next slide, please. So there are state pharmaceutical assistance program, and some states have programs. These programs are designed to help individuals with limited income save on the paying of their prescriptions. And also those individuals on Medicare Part D who may take a medication that is not covered by their plan, and even though they have applied for an exception for that coverage, let's say it was denied by the provider, then they could take advantage of this prescription drug assistance programs, these state pharmaceutical assistance program, to get those medications at a discounted price. Now, each state runs its own program, okay, but it allows for a lower cost for individuals for medication, and especially medication that is not covered under Part D plans. Next slide. Then there are patient assistance program. Many drug manufacturers have programs that help people with limited income afford their medicine. Through these programs, many drug manufacturers offer the medication for free or at a discount. Next slide. So let's go to SNAP. So SNAP is actually called Supplemental Food Assistance Program. It helps you buy food that you need for good health. With SNAP, you will get your benefits on a special debit card called an EBD card. And you get this benefit once a month. They load it on your card. You are allowed to, your EBT payments are good for 1 year. It amazes me how many people hold on to their SNAP benefits. After you receive a payment, and if it's over a year and you haven't used that, then they take that benefit back. So don't hold on to it, use it. This card allow you to get food at many grocery stores, as well as through some senior centers and home delivered meals programs. They also have a program to help you learn to eat healthy and to stay active. And SNAP is a income-based program and will depend on your income, such as the money you receive from your job, Social Security, interest. It also can include any IRA disbursements that you take. If you take those disbursements on a regular time frame, like if you take a disbursement monthly, or from a 401k if you take it monthly. But it also takes into consideration your housing and utilities and medical cost. Next slide, Jen. So when it comes to SNAP income eligibility limits, so this is the new most recent one put out for October 1st, 2021, and this will be good to September 30th, 2022. So you have the household size, and it goes up to 8. And for each additional member outside of over the 8, you could add $492 to the income. So the gross monthly income has to be at 130% of poverty level. So for a single individual, that is $1,396. Then the net income level, which is 100% of poverty level, is $1,074. So how this works is they take your gross income. They take any income you get from your job, Social Security, pension. Like I said, they could take IRS distribution if they're taken on a regular periodic time frame, 401k distributions and whatnot. So they add all that up, and that's your gross income. So for a single individual, if they add all that up, and they do take into consideration certain deductions, what we talk about, they'll do the deductions for the housing and the utilities and medical expenses and whatnot. So they grant certain deductions. If your gross income comes out to $139, you met the first half of the qualifying factor for SNAP. But then you have to meet the net income qualifying factor. So what they do is they take that gross amount and they multiply it by 30%. Okay. And if that 30% falls up under what that net amount is, then you meet the second requirement, which is the net income. That means you are qualified for SNAP. And then from there, they go on to calculate how much of a monthly benefit that you will receive. Now, with the pandemic, they were allowing everybody the maximum amount for their individual categories, but they review that on a monthly basis. Next slide. So what deductions are allowed in SNAP? These are the deductions that SNAP allow. They take a 20% deduction from your earned income. Then they do the standard deduction. For a household from 1 to 3, the standard deduction is $177. For a household of 4 or more, that standard deduction is raised to $184. Then if you have a dependent care deduction, for work, training, and education. So if you have child care or some other type of dependent care, that is deducted. Then medical expenses for elderly and disabled members that are more than $35 for the month will be deducted. Okay. In some states they legally allow child support payments, and in some state, um, and in Ohio, we have what is called a standard shelter deduction for the homeless households, and that is at $159.73. So all these deductions are taken from your gross income. This is why one of the most questions I get from people who call in to apply for SNAP, and they may get turned down. Um, my neighbor gets more money than me and she qualified for SNAP. I only get so much money and I can't get qualified. Well, everybody's situation is different. Does your neighbor own her home? They take into consideration your mortgage payment. They take into consideration your property tax. They're taking into consideration your utilities. Is this homeowner? They're paying electric, gas, water, and telephone. So those things help bring down individuals' gross monthly income that allow them to qualify for SNAP. Now, if you just pay rent, and with rent, all you have to pay is electric, you're getting less deductibles and you may not qualify for SNAP. So this is why you see that sort of like imbalance there. It's what your housing costs, your living expenses that they take into consideration for the SNAP program that really allows individuals to qualify for the program. Next slide, please. So excess medical expenses. For elderly members and disabled members, allowable medical costs, as I said, over $35 a month can be deducted unless an insurance company or someone who is not a household member pay for them. Most medical and dental expenses, such as doctor bills, prescription drugs, and other over-the-counter medication, when approved by a doctor, dentures, inpatient, outpatient hospital expenses, and nursing care. These things can help bring that gross monthly income down. They also include other medically related expenses, such as certain transportation costs, attendant care, and health insurance premium. Next slide. Excess shelter cost deduction. The shelter deduction is for shelter costs that are more than half of the household income after other deductions. So the allowable shelter costs are fuel to heat and cook with, electricity, water, basic fee for one's telephone, rent or mortgage payment and interest, and property taxes. What resources can I have and still get SNAP? Households may have $2,500 in countable resources such as cash or money in the bank account, or $750 in countable resources if at least one of the members of the household is age 60 or older or is disabled. However, certain resources are not counted when eligible for SNAP. Home and a lot resources of people who receive supplemental Social Security income, resources of people who receive temporary assistance for needy children. Most retirement and pension plans withdrawals from these accounts may count as either income or resources depending on how often they occur. And another thing I want to note here is that stimulus money, the money that we receive for stimulus, is not counted in the calculation. Now, how long that's going to last, I'm not for sure, because the purpose of the stimulus money is to go out and spend it, not to hold on and develop a savings account. But as of right now, they do not count any stimulus money that an individual may be holding on to in their bank account as a resource. Next slide, please. So other food assistance that may be available, the Emergency Food Assistance Program called TAF. It helps you get basic foods such as fruits, vegetables, cheese, pasta, soups, beans, which are necessary for adequate nutrition. You may visit a local agency like a food pantry, a soup kitchen to receive the food or a free meal. And it's different in each state. In the handout list, I have there, I think it's the Greater Cleveland, a list of all the pantries and the numbers. So make sure you check out the information that is in the handout section. Next slide, Jen. Then we have the Senior Farmers Market Nutrition Program. This program provides coupons to buy fresh fruits, vegetables, honey, and herbs. You may use these coupons at the farmers market, roadside stands, and community programs that grow fruits and vegetables. And who can apply? People aged 60 or older with low incomes may apply. Now, if you are on SNAP, they do this thing where you get double the produce if you use your SNAP card when you make your purchases. Next slide, Jen. So some other assistance programs that are out there are the Low-Income Home Assistance Program. This is the HEAT program. It can help you with your fuel bill so you can stay warm in the winter and cool in the summer. And by doing so, help reduce your health risks and safety problems and the amount that aid that you receive and how often. Now, in this program, you have like 3 opportunities to apply. There is the HEAP payment. This is a one-time payment that you can apply for HEAP for your gas and electric. Then you have what is called the Summer Crisis Program that just recently ended. The Summer Crisis Program is a one-time payment for your electric costs to help bring you current or pay down the bill. And then you have what is called the Winter Crisis Program that should be starting soon. Now, the Winter Crisis Program, you could submit both your electric and your gas bill because some homes are heated by electric. Okay. Unfortunately, Cleveland Public Power, also PIP. PIP is a part of this program. That's the percentage of income program. What PIP is that it's kind of stabilize your heating and cooling costs over the year. What they do is they take your gross monthly income and multiply it by 6%. So that would be your monthly payment for your gas and your electric. So you'll always know how much that payment will be. And that helps budget wise. However, some people find that the calculation of the PIP payment is higher than what their normal costs are. So what I often suggest to them is that they contact their provider and have them do a look back and come up with a budgeted payment on their actual usage. Sometimes that could be lower than the PIP program. Now, with the PIP program, the Cleveland Public Power does not participate in the PIP program, but they do participate in HEAP, Summer Crisis, and Winter Crisis. Next slide, please. Then there's the Weatherization program, which makes your home more energy efficient. Now, a lot of people don't realize that the Weatherization program is for rental property too. It's not just for homeowners. They have applications for renters that they can apply. So they do things like they come in and they make sure that your home is efficient, that there's no air leaks. They check your furnace to make sure it's running properly. They check your hot water tank, do any repairs that may be necessary. And one of the things that they do with this program, they have this refrigeration program where they'll come out to the home and they'll test it to make sure it's running efficiently. But this is for homeowners. And if it's not running efficiently, they will look to get it replaced for you so you could save on your electrical costs. Next slide, please. Then there is the Lifeline phone discount program. Lifeline can help you get a monthly discount on your basic wireless or your home telephone service. The discounting can help lower your phone bill or provide you with free wireless minutes. You get these discounts through your local telephone company. This application can be done online, or you could download the actual application and send it in. One of the requirements with this program is you have to be a recipient of SNAP, Medicaid, disabled, or meet their income requirements. Next slide, please. Then we have the property tax relief. Many counties and cities offer property tax relief to seniors and people with disabilities. These programs can either lower the cost of your property tax bill or exempt you from your tax entirely. This is called the homestead property tax. This is for homeowners. Also, there's the homestead water reduction program. This is for homeowners also, which will help lower your water costs. So I want to close out to talk about some hot topics that are up. We have the health emergency that, we have to look at it expiring. We hope that this is not going to be permanent. What will happen when this comes to an end? One of the fears that will happen when this comes to an end is that we're going to get a lot of people that are going to be kicked off of their assistance program, their SNAP program, and their Medicare program. And the reason being is because while we're in this health emergency, there's no recertifications going on. So if you're receiving these, then you continue to receive those benefits until this expire. But once it expires and they go to the recertification, there may be a lot of people who are going to get kicked off the program because of changes that have taken place over the year. So, as I said, the Medicaid renewals have been suspended. They also extended the low-income subsidy coverage through 2022. However, like I said, when this becomes reinstated, your Medicare termination is not a guaranteed issue opportunity for Medicare supplements. Then I want to talk about the conditional Part A. This is for individuals who do not meet their work quotas to receive Medicare Part D, the hospitalization for free. There is a conditional Part A. You have to apply through Social Security Administration and you have to be specific and say you want to apply for the conditional Part A. There is an income requirement for it, and you pretty much have to be qualified for Q&B. So it's two-part. You apply for the conditional Part A through Social Security Administration, and then you apply for the Q&B through Medicaid, Jobs and Family Services. Now, they suggest that with the Q&B that you don't apply online, that you go into the office and do this, because there's been some quirks with them doing this online. But what this allows is for those individuals who have not gotten in their work quarters to actually receive coverage for Medicare Part A and Part A through Social Security. Next slide. So we want to open it up for any questions. So Jenny, do we have any questions?
Thank you so much, Cynthia. Yes, I'm going to read you a couple of questions from our audience. So who should I call if I have questions about my eligibility for various benefits discussed today?
Actually, you could call me because I am the benefits specialist at ESOP, and I will have my information on this presentation. There's a PDF available with it, but you could just reach out to me at 216-373-1650. And what I will do is it's a benefit assessment. I'll ask you some specific questions. We do this through the NCOA website, and it'll bring up benefits that you may qualify for. And then we'll discuss them and see what it is that you would like to apply for, and then help you process those applications.
Thank you. And does ESOP charge for services?
All our services are free. We're a nonprofit organization. We don't charge for any of our services.
Thank you. And then the last question for today, how does ESOP work with clients to assist them with open enrollment or to determine eligibility for other benefits?
Very good question. So as I said earlier, open enrollment begins October 15th, and I am a OSHIP certified counselor, and part of my job is to help those individuals go in to the Medicare.gov site and review their plan options. So I would just give me a call. I'll put you on my calendar. We'll go in, we'll input all your medications, because with the Medicare Part D plan, the plans are based on an individual medications that they take. You know, a lot of people go into the site and they look at the premium cost, and they'll find that this plan has a premium cost of $7.30, and this other plan has a premium cost of $21. So they want the $7.30 plan. But when you put their medication in there and you look at their out-of-pocket costs, it's so enormous that this is clear that that's not the wrong plan for them. So sometimes what I do is help guide them through that to see what plan is going to provide the least out-of-pocket expense for them. And then also through that process, we'll check to see if they're eligible for any of the assistance programs, like the LIS, the extra help for your medication costs, to help take care of your premium costs and possibly your deductible costs. Apply for if eligible, one of the Medicare Savings Plans to try and get that $148.50 taken care of.
Thank you. We did have a couple other questions come through, Cynthia, and I know we are running short on time, but hopefully we can get through maybe a couple more. So someone asked, do you lose SNAP benefits if you do not use them by a specific time frame?
You got 1 year to use your payments. And when I say this, so you got a payment for SNAP, let's say in January. And if you're still holding that, and then that 1 year come around and you're still holding January payment, then they take that back, because clearly you didn't need it. And you'll be surprised how many of my clients that, that I have that hold on to the SNAP benefits. And I'm surprised that they give them a year, because there's supposed to be a need for this. But a lot of people hold on to them. Those benefits are good for 1 year. So if you
Thank
receive
you.
in January, it expires in January. You receive it in February, expires the following February.
Thank you. Last question. Do you help customers in other states besides Ohio?
Medicare Part D, yes, but as far as the and that's because Medicare Part D is a federal program. So the plans are based on, when you go into the site, one of the first things they ask you for is your zip code. And when you put in the zip code, they're only going to bring up the plans for you in your area. So yes, with Medicare Part D, I can assist people in other states. But when it comes to Medicaid, those are state-ran programs, and every state have different guidelines for their programs. Long as their programs are within the federal mandated guidelines, but they do have a lot of leniencies, the state, on how they administer those programs. So I would go crazy applying for Medicare and some of the other benefits for other states. But for Medicare, yes. Medicaid, no.
Thank you so much, Cynthia, and I will turn it over to you, Jen, to close us out today.
Thank you very much. Cynthia, I don't know if there was anything more you wanted to say in regards to this next slide.
These are just some of the programs and stuff that we offer, and I just want to give a if you could go to the picture with our team. This is my information right here. This is how you could contact me. My email address is cwalker@benrose.org, or you could call me directly at 216-373-1650. If you'll go to the next slide, this is our ESOP team right here. That's me hiding in the back over there. And then our sponsors that allow us to bring our services to you guys for free. So we always want to give them a thank you and a shout out. And
Thank you very much.
thank
Go
you
ahead.
guys for having me today.
Thank you, Cynthia. And thank you all for joining us for today's program. We did just shoot a link to you in the chat. If you could take a very brief survey for us to help us let us know how we did. We're constantly trying to improve our programs. And we hope you'll join us for future virtual programs for caregivers offered monthly. Please save the date for our next program on November 3rd. More details and registration will be available soon on our website at benrose.org. Thank you and have a great rest of your day.